Okay, so I've reviewed my order and my patient's medical chart. And I have my stethoscope for listening to the lung and heart sounds. And I'm going to knock on the door and close the curtain for patient privacy. And I'll wash my hands and put on a clean set of gloves. Hi, my name is Peyton. I'm going to be your student nurse today. Could you verify your name and date of birth for me?
Ending October 20th, 1999.
Okay, perfect. I'm going to be performing your cardiac pulmonary assessment today. I'm going to start by asking you a few questions. Do you have any allergies?
No.
Okay. Are you on any current medications?
No.
Okay. And for this assessment, I'll have to get close to you and touch you. Do you have any cultural concerns that would not allow that?
No.
All right, perfect. Are you in any pain?
No.
Do you have any goals of care before we get started?
No.
All right, perfect. And next, I'm going to ask you a few history questions. Have you had any shortness of breath?
No.
Or respiratory problems?
No.
Any activity intolerance or fatigue?
No.
Do you have a history of high blood pressure?
No.
Have you had a stroke?
No.
Or any heart conditions? Have you had any chest pain?
No.
Or dizziness?
No.
Have you had a cough?
No.
And do you smoke?
No.
Perfect. Okay, so are you ready to get started?
Yes.
Okay. First, I'm going to inspect your neck, and I'm going to be looking at the cardiac and jugular vein. Okay. Everything looks good. I don't see any pulsations, and as you can see, nothing is distending. Now I'm going to check your pulses. All right, that one feels normal, and I'm going to check the other side for equality. Okay, and they feel equal. Next, I'm going to palpate your trachea. You feel any tenderness? Okay, and I don't feel any lumps or bumps, and it looks to be in the right place. So next, I will inspect your chest. You just sit up for me, and I'm going to place my hands right here, press down, and if you could take a deep breath in and out. Okay, perfect, and it feels equal and normal. So next I will be listening to your heart. So I'm going to start listening to the S1 sound, which is the aortic valve in the second intercostal space. And then I'm going to come straight across to listen to the pulmonic valve, also in the second intercostal space. Okay, then I'm going to listen to the tricuspid valve, which is in the fourth intercostal space. Alright, and then I will listen to, if you could sit up for me, I'm going to listen to your the apex of the heart, which is in the fifth intercostal space, and I'm going to listen to this for 1 minute. Starting now. Alright, perfect. And they all sounded normal and regular. If you could just stand up for me and turn around. I'm going to listen to your respirations. Get up a little bit. Okay. And every time I place my stethoscope down, if you could take a breath in and out. Perfect. And if you could turn around for me, I'm going to listen to the lateral. Back a little bit. Okay. And same thing when I set my stethoscope down, breathe in and out for me. Next, I'm going to listen to the front. Alright, perfect. You can just turn around for me one more time. Every time I place my palm down, you can say 99.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Okay, perfect. And next, I'm just going to push this together. If you could take a deep breath in and out for me. Alright, perfect. And I don't see any discoloration and all the skin is intact. Okay, you can turn around and have a seat for me. Next, I'm going to listen to your pulses. I'm going to start by listening to your radial pulse. I'm going to listen to this for a minute. Alright, so I got 70 beats per minute, and I would pretend as if I was still checking the pulse and count the respirations. Alright, now I got 18 respirations. Now I'm just going to check your other radial pulse for symmetry. Alright, sounds good. Next I'm going to be checking your brachial pulse. It feels good and normal. Next I'm going to check your other one for symmetry. Alright, sounds good. Now if you could just lay down for me. I'm going to palpate your chest. All right. I'm going to go back. When I was assessing his respirations, the bronchial sounds up here sounded high-pitched and louder, and the ones down here were more low-pitched and soft, and I didn't hear any wheezing, crackles, rhonchi, any grunting, so that means that there wasn't any fluid or obstructed airways. And when palpating his chest, it was hollow, and his coastal looks good, and his intercostal space also looks good. So next I'm going to feel your other pulses. So I'm going to start with your femoral pulse. You mind if I...
Go ahead.
And feel the other side for equality. Alright, next I'm going to be feeling your popliteal pulse under your knee. Alright, that's good. You feel this one. Okay. Next I'll be doing your dorsalis pedis. You can put your knee up for me. Sorry. Alright, good. That's the other one. Okay, and last, your posterior tibial. And then I'm going to check this side for equality. Alright, perfect. And then I'm going to check your toes for capillary refill. And do this side. Okay, perfect. Now if you could just sit up for me. And last, I'm just going to check your fingers for capillary refill as well. Okay, another one. Alright, and they all refilled within 2 to 3 seconds. That is good. So that concludes our assessment today. Do you have any questions?
No.
Alright, so here's your call button if you are in the hospital. I'm going to take my gloves off, wash my hands, and I will document this and compare it to his baseline.